Good evening. First of all, I'd like to apologize for my absence, and I want to thank my team for putting this together. Some justifications for research in third world countries are those of examples as the Tuskegee study of the women. Um, these women would not receive an antiretroviral treatment anyway, so investigators are simply observing what would happen if the subjects, infants, if there was no study at all. And a placebo-controlled study is the fastest, most efficient way to obtain unambiguous information that would be the greatest value in third world countries. The Secretaries of Health and Human Services and directors of national institutes of organizations sponsoring the studies argued it is an unfortunate fact that these studies do not include any HIV intervention at all. The inclusion of placebo controls will result in the most rapid, accurate, and reliable answer to the question of the value of the intervention being studied compared to the local standard of care. One reason ethical codes are unequivocal about investigators' primary obligation to care for the human subjects. Their research's strong temptation to subordinate the subject's welfare to the objectives of the study. That is particularly likely when the research question is extremely important and the answer would probably improve the care of future patients. In those circumstances, it is sometimes argued that obtaining rapid, ambiguous answers to research questions is the primary ethical obligation. Example of an unethical research that had happened, I would like to remember the Tuskegee study of untreated syphilis. We all have heard of it. I think we had to submit a paper, I think, in a class or two ago. But in this particular research by the U.S. Public Health Services, it lasted from 1932 to 1972, where 412 poor African-American men were untreated syphilis were followed and compared with 204 men that were free of this disease to determine, the natural history of syphilis. The study continued even after the penicillin became available and was highly effective against syphilis. There were multiple ethical violations. These subjects, these men, did not provide informed consent, and they were deliberately deceived. They were denied the best known treatment, and the study was continued even after, penicillin became available. The argument there in association with some thought that was ethical to these researchers that these poor African American men probably would have not been treated anyway, so they were just letting nature's run its course. By the investigators observing came to the conclusion, as they usually do in most studies, is what would have happened if there was no study experiment, and that the study was highly important. It was a never to be repeated opportunity. Why would anybody want to repeat that anyway? One physician said that was a never to be repeated opportunity. Ethical concern was that the information was valuable, especially for rural populations with a very high rate of untreated syphilis, and this was an experiment done also to show examples of what would happen, in third world countries and what they needed to do to obtain cures for certain diseases. Most of the third world countries are part of the very vulnerable population, which have language barriers. This may cause confusion when consenting to research, and in some countries, they don't approve of signing documents, and informed consent may not have the same meaning in poor illiterate populations. Some cultures have differences, and they may do things according to their own beliefs or have different approaches in certain practices. Most of the population in rural areas are poor, desperate, and in hopes for a better future. This makes this population in third world countries even more vulnerable. Um, Investigators are in hopes and expect that new treatments will be better in the future, but this the fact is that they do not know what the outcome is, and if they did, they would be guilty for knowingly giving inferior treatment to some participants in trials, and it is necessary for investigators to get a control on placebo trials. Only when there is no known effective treatment is it ethical to compare a potential new treatment with placebo. When effective treatment exists, placebo may not be used. Investigators are responsible for all subjects enrolled in the trials, and the goals for the research are always secondary to the well-being of the participants. Even though informed consent is important, it is not enough protection because the asymmetry in the knowledge and authority between researchers and their subjects. The ethics of ongoing trials in third world regimens is basically to prevent infection, transmission of human immunodeficiency, HIV virus. The increasingly global nature of health research, in particular in conduct of clinical trials that involve human participants, has recently highlighted new ethical issues. The research may be simply to help the host country address public health issues, or it may be to reflect research assessment that foreign locations is more convenient, efficient for conducting these particular clinical trials, and it might be more beneficial to address health concerns faced by both parties. They say that it is said that that there's more funding available in these areas. The economic dilemma of whether and how to sustain an intervention if the trial shows to be effective after the research is over. Perhaps most important of all is the issue of how to develop an ethical model for research. Questions about research ethics, the designing, conducting, and following up on clinical trials will always be an issue in third world countries, but we can only hope for a better result. Thank you.